back in 2006, 2007, we hardly knew what physiotherapy was. So, thing is that we always used to get trained for being an engineer or a doctor, and we just study. Marks used to be very important to us. I recently even went and saw a robotic knee surgery just to get the view of what is going to happen when the patient is going to be out, and I will be doing this physiotherapy exercises on that patient. So I was into Maharashtra University, and Maharashtra University papers are much difficult and they are more strict, as you know, the reputation of our Mumbai University. That in India, we are short of doctors. Every thousand people have one doctor. So that's why if we are called in
Wow.
emergencies, we will have to go. So people who click at the barber's office, please stop doing that because patients have gone into coma and got into severe slip disc injuries. So do not click your neck as if it's a play. The job satisfaction that we get in India is much different from what it happens when you are over there. She had come up with so much of faith, and she said that doctor, आप मुझे ठीक करोगे.
Namaste दोस्तों, welcome back to our show Career Storyteller, where we share stories and build careers that are not conventional. आज भी हम ऐसे ही एक नॉन कन्वेंशनल करियर जर्नी लेकर आए हैं. क्या आपका भी सपना डॉक्टर बनने का है और MBBS के अलावा कोई और ऑप्शन पता नहीं है? तो ये एपिसोड आपके लिए है क्योंकि आज हम फिजियोथेरेपी के बारे में जानेंगे हमारे गेस्ट डॉक्टर केतकी मोरे के साथ. डॉक्टर केतकी मुंबई की एक बहुत ही क्वालिफाइड फिजियोथेरेपिस्ट है. उन्होंने यूके से फिजियोथेरेपी में मास्टर्स किया है और साथ में PPTH और MIA जैसे सर्टिफिकेशंस भी किए हैं. यूके में 2 साल पढ़ाई और साथ में काम करते उन्हें ये एहसास हुआ कि उनको भारत वापस आके यहाँ की लोगों की सेवा करनी चाहिए, ना कि कोई फॉरेन कंट्री में. वो आज 10 साल से भी ज़्यादा एक्सपीरियंस के साथ मसल्स और बोन्स की प्रॉब्लम में एक्सपर्ट है. लेकिन ये तो सिर्फ एक शुरुआत है. शी इज़ ऑल्सो अ चैम्पियन फॉर हेल्थी लिविंग एंड यूजिंग नॉन इन्वेसिव टेक्निक्स लाइक मोलिगन मैनुअल थेरेपी, पिलाटेस, मैकेंजी एक्सेट्रा टू हील पेशेंट्स होलिस्टिकली. इंडिया की टॉप 10 वुमेन फाउंडेड फिजियोथेरेपी क्लिनिक्स में से एक उनका क्लिनिक फिजियो रिलीव है. डॉक्टर केतकी ने अब तक 5,000 से ज़्यादा लोगों का इलाज किया है. वो सिर्फ क्लिनिक तक ही सीमित नहीं है, वो मैराथन्स ऑर्गेनाइज करती है और NGOs के लिए हेल्थ ड्राइव्स भी चलाती है. डॉक्टर केतकी मोरे का सफ़र आपको ये सोचने में मजबूर करेगा कि फिजियोथेरेपी आपका करियर हो सकता है. सो विदाउट मच अडू, लेट्स गेट स्टार्टेड.
Hello, Ketki. Welcome to the Career Storyteller. It's a great pleasure and honor having you on our show. Thank you so much for joining us today.
Thank you, Ramya. It's my pleasure.
And also let me rephrase it as Dr. Ketki because today we want to understand or want to know your journey as a physiotherapist, and we want to learn about physiotherapy and so that people or youngsters who want to pursue this career or career as physiotherapy, then maybe they should understand or learn from your journey. So to begin with, a basic question: what sparked your passion for a career in physiotherapy? Did you have any personal experience that drew you to this field, or maybe you were always passionate about doing physiotherapy as your career?
Actually, it has been a chance that I have come into this profession because back in 2006, 2007, we hardly knew what physiotherapy was. So, thing is that we always used to get trained for being an engineer or a doctor, and we just study. marks used to be very important to us. So what I did was I was doing my job of studying, and at that time, incidentally, my grandfather had Alzheimer's, and doctor had suggested a movement disorder therapy, which is a physiotherapist, and we were looking around, but we couldn't find any. And for more than 5 years, he was bedbound, and we had all the complications of respiratory to bed sores and everything and whatnot. But when I got to know that there was a solution for this, like a physiotherapist could have made a difference in his condition, then I started taking this profession seriously. So when I was going for my MBBS entrance exam, and I gave all my papers and all that. So when I had an option of dentist and physiotherapist, I was like, I'll go for physio because I want to make a difference to the whole patient as such. And dental has never been my passion. So, and also being a player from the childhood, I have been a swimmer, badminton player, skater. So I was more into exercise and sports. So even that has been helping me that I don't get bored with physiotherapy. Like exercise has always been a part and parcel of my life. So that's why it has helped me to relate physiotherapy to sports and also to patients.
So maybe it's right to say that your own experience in terms of ensuring how to take care of your body is what made you make that decision that I want to get into physiotherapy, right?
Yes, 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 exactly, exactly. I used to love exercise right from the start, and I turned my love into passion and into profession.
So wonderful to know, or maybe to understand that turning out your own likings into your own profession is obviously it's the right thing or maybe right choice to do. But we'll talk more about your entire journey. But I think we'll slice it into more smaller bits. Before we get into that, I think maybe let's start with the very basic thing is to understand what physiotherapy is all about. Would you like to explain or maybe help us in a very simple way what physiotherapy is all about?
So physiotherapy is about movement disorder. Movement disorder means when somebody is not able to move their part or when the part is in pain in musculoskeletal system and also in the neurological. Musculoskeletal includes joints, bones, spine, and the neurological covers all the brain of problems like somebody has a stroke or somebody has paralysis, a trauma, spinal injury, all that comes into neurological. So there are two phases which are main branches of physiotherapy, whereas other branches are also gynecological, sport, and I would consider sport into musculoskeletal because most of the things that we do in sport are musculoskeletal. So it is just a very fancy field and it's very much shown in the media. But sport actually requires understanding the biomechanics of the player. If a player is playing cricket, we should know the biomechanics of cricket. If the player is playing badminton, the shoulder biomechanics are very different from what a basketballer should do. Okay. So that's how these fields are differentiated. But basically, physiotherapy is like, correcting the mechanical fault. So, mechanics, anything wrong with the mechanics are treated by physical means like heat, cold, electrical stimulation. So, electrical stimulations play a major role in paralysis where the patient is not able to contract a certain muscle, not able to uh, generate electrical own impulses. So our body is also made of electric current, which the stimuli comes and the muscle contracts. Okay, so we mimic those by our instruments and we give a lower frequency when the paralysis has set in and slowly, slowly, slowly we increase the frequency and the patient, as the patient starts recovering. So it's very crucial to a movement disorder that physiotherapy has to be included in the treatment most of the time references are not given on time. So people should be more and more aware that they should go to a physiotherapist when there is anything wrong with the walking, with maybe catching a ball, or maybe removing your clothes. Okay, that is a major indication of a frozen shoulder or any other disorders. If you are having back pain during the day at any time, more than 3 times in a day or more than twice in a week, then you should definitely see a physiotherapist.
Oh wow, that's so amazing to understand the basic meaning of physiotherapy, because I know that there are a lot of stuff that is written on media, and as you rightly mentioned, it's a fancy kind of a profession where people say that okay, this is related to sports and this is related to maybe all high profile or lifestyle related things, right? So maybe we'll talk about that in some time maybe. But then I want to bring focus back to your education, since you mentioned about the education. And all of us know that डॉक्टर की पढ़ाई कोई मामूली सी बात नहीं है. It is so taxing and so demanding. Definitely challenges हुए रहेंगे. I'm assuming that there would have been challenges in getting the degree of physiotherapy doctor in physiotherapy. So were there any challenges in your education and academics, and how did you overcome those challenges? Because this question is for people who want to take up this career as physiotherapist, but then they don't know, right, कि क्या क्या हो सकता है, क्योंकि in books or in media what people might find is okay, ये पढ़ाई करना है, ऐसे ऐसे करना है, but actually अगर किसी ने अगर वो जर्नी जिया है, उनसे आएगा तो लोगों को पता चलेगा कि क्या क्या तकलीफें होती है, राइट, और क्या क्या चैलेंजेस आ सकते हैं. वुड यू लाइक टू टॉक अबाउट दिस?
Yes, actually, I appreciate you, Ramya, for including this question in the podcast because usually I see people going to physiotherapy because shortcut में doctor बनना है. Okay, that is absolutely not true because the first 3 years are same as MBBS. Okay, if not, the portion is not that extensive, but first 3 years you have to be with the MBBS students. You have to dissect the dead bodies. You have to uh, do the blood analysis. Everything is the same. Okay, it's not that easy because you will have to see surgeries as well. So in our times, we had the privilege, we should say, that we had and we could go and see what surgery is happening because many a times physiotherapists do work with cesarean section, with knee replacement surgery. So I recently even went and saw a robotic knee surgery just to get uh, the view of what is going to happen when the patient is going to be out, and I will be doing the physiotherapy exercises on that patient. So you have to see blood, flesh, and you have to get used to hospital first of all. The other thing is there is a lot of extensive study. After that, you have not only MBBS subjects but also physiotherapy subjects at every level or in every year. And last year is completely physiotherapy application of that into your practice treatment. And the last thing is after that you have a thesis which you have to do. You have to write a project. It is a research which you have to do in a span of 6 months and complete your internship at the same time. So if you're lucky, you complete both of the things together, but most of the time that is not the case. So I took good 6 months extra to finish all the subjects and then finish my thesis and get my ICT internship completion certificate. So I was into Maharashtra University, and Maharashtra University papers are much difficult and they are more strict, as you know the reputation of our Mumbai University. So it was a tough job, but it was worth every minute. And the fun that we had even while studying, even when there is a dead body around, those moments are precious. Can't explain those in words.
So while you were talking about your education, Obviously, the one of the myths that you definitely brought into picture is like the shortcut to become a doctor is not a physiotherapy. You still need to go back, study. You need to put those efforts, reading or understanding about the human body. And when we say a human body, it's right from the head to the toe is what goes into that, right? And then becomes the layering about ensuring the mechanics, or as you were saying in your previous answer, the biomechanics around it maybe comes later, but to reach there is no shortcut. You still need to go through the grinding of a normal medical student, right?
Yes. That in India, we are short of doctors. Every 1,000 people have one doctor. So that's why if we are called in
Wow.
emergencies, we will have to go and they make sure that they train you in each and every aspect. So that goes both ways. We are lucky as well that our anatomy is much clearer when we look at dead bodies or parts, actual parts, whereas in many countries they teach physiotherapists on a 3D model. So we have to feel fortunate that we are getting to study this firsthand, right, with the hands-on experience.
Absolutely. And I can vouch for your treatment as being your patient since the longest time. So I can vouch for your treatment whenever I am in need of releasing my pain in the back or whatever due to the kind of a job that I am into. It's like I cannot think beyond Dr. Ketaki. So it's like for me, whoever suggests me that any other doctor can, I'm like, no, no, I'm not convinced. I will bear that pain unless and until I visit Dr. Ketaki, so I can vouch for the experience that you bring in and the hands-on experience that you have got for sure. So what I want to ask maybe next is, or maybe understand is, how does your day look like? I mean, I know that you are a very busy doctor and you have got multiple clinics in Mumbai, and you also do a lot of seminars, webinars, and you also provide your, services with the reputed people, reputed organizations in their marathons or a kind of initiatives, right? So how does your day look like if I have to ask you a day in the life of a physiotherapist?
So if you want to walk with me in my day, then I have to tell you that I don't walk, I run, because every minute is precious and covering all the patients in a day is a big challenge. So it's been quite busy. Like I wake up 7 a.m. in the morning and at 8 o'clock I start my first patient. And slowly as the day progresses, with very short breaks in between, I end up at 10 p.m. 10 p.m. is what I'm saying the earliest. So it's really challenging because sometimes we have to see knee replacement patients twice in a day. So we have to find time for surgery cases as well as people who are bedridden. So I'm treating three neurological patients on a daily basis, which is Parkinson's, ALS, and stroke. So neurological patients go a long way, and sometimes we even have to lift the patient into sit to stand. So we
Wow.
need to have that kind of strength. So physiotherapist has to be a very strong person. Okay. I don't know how people say that it's a woman's field. Actually, it's not. Because you need to be very strong, even the mobilization and the manual technique. We do not have a very intensive manipulations like you hear a click every time, how to show in some YouTube videos.
Exactly. Yeah.
It's not the magic. We don't do that. We do something in between, which is also in control of patient and even the movement is brought up. So it's about the joint play. When the bone is moving, there is certain movements which are not in your control. Those are accessory movements happening inside the joint. So we move that and we maintain that accessory movement. The oiling of the joint becomes better, and then slowly the part starts moving. So uh, that's how, and you need strength for that. So your grip, your hand grip, your uh, own muscles of your body have to be very strong to maintain the patient. And sometimes patients faint while you are doing a certain maneuver on them. It's the first time when people have trauma, like of when the part is being touched which has not been, the nerve has not been open for a long time. So they faint.
Correct.
You should have the strength to hold the patient as well. So
My
exactly.
God.
So it's not a woman's field; it is actually a man's field. Sometimes you have to be with the team all the time, like as you mentioned, marathon. The whole day from morning to evening, we are on the field with players in the sun. They need constant. I was a part of ultra marathon, so we needed constant. In the second or third round was going on, everybody was cramping. Every other player was cramping. So we had a huge team there waiting for all the physio, mobilization, stretching, then making them drink water. So one patient, unfortunately, we had to put on saline as well. So you need to be
My God.
very much aware of what the SOS practices have to be known to a physiotherapist. And as you
So,
mentioned, Ramya, that you were my old patient. So I remember that Vivek could not even identify where the problem was when he met you. So I think that is the compliment.
Yes,
So you got
absolutely.
completely better from Vivek. So your movement loss was completely gone. So that's how we
It's
treat
like,
from the root cause.
yes, if I have to maybe cover my story, I could do a entire podcast on itself. I mean, the kind of an adjustment that you did, the kind of I would say, chronic things that I was carrying, and the things that you have changed in my structure, body structure, posture. I mean, that is amazing. As I mentioned, I can do an entire podcast on that. I cannot recommend you enough.
Yes, that's the kind of movement.
okay. So I have one very simple question. I don't know, and this is because why you said is like lot of videos goes around in YouTube where you see people breaking all those body parts, and those sounds come out and tuck tuck tuck. So I don't know whether it's would you like to differentiate between that aspect of medical and the physiotherapy aspect? What is the difference? What is the science behind both of those practices?
So when we actually click zone, the sound is not so much that would alarm you every time. So usually these people have a small speaker hidden over
Correct.
there, and when you push the button, the cracking sound comes from that speaker. So you should not get fooled by such adjustment, because when you see, the things have to be very precise, and spinal kicks are not that loud most of the time. So you don't get fooled. And one more thing, you don't require to click each and every person. The problem sometimes is very much acute, and if you click the patient that time, maybe the patient might aggravate. So maybe the second thing is, maybe you feel that it's good for you, but the problem comes back. So it's not a permanent solution unless you strengthen the part, you change the position of the part, you stretch the structure. So that takes time. It's like how you have a rubber band. You stretch it, it goes back to its place. You stretch it, it goes back to its place. So clicking is like that. But if you stretch, you strengthen, then you get actually the difference in the length of the muscle can be brought about, and the problem can go away. So those are the two pros and cons I would say about clicking. But otherwise, if you want temporary relief, that is a good way, I would say. But do it from a proper professional.
And isn't it more of a chiropractic than a physiotherapy, right? I mean, practitioners, they click a lot, and physiotherapists, because I know I have been your patient, so I know for the fact that I did not hear that much a sound even when you kind of stabilize me, right? So it would be hardly audible to myself, or maybe at the most you could hear that because you're operating on me, right? But then when I'm gonna operate, not literally tearing apart, but just you're working on me, right? But then I don't think so any other third person would be able to hear that. Am I right in that?
Exactly, exactly. The sound may not travel to another room as well, you know. So what I'm saying is, uh, when you are choosing a chiropractor, so I have known very old doctors, like there have been a tradition in India where they call Haad Vaidya, you know. So usually
Correct.
they used to kick a patient and kick the bone. Correct. So those were such doctors, you know, they used to be very humble and they hardly used to charge to the patient, but they had a lot of experience. They used to see more than 100 patients in a day. And I have even heard stories of fractures getting set by them. So I would say those are real doctors, and a doctor is always rated by his experience. So if you get such an experienced doctor, you should only give yourself in those hands. Otherwise, you would rather go for a professional who has a proper degree. So we have extensive manual therapy courses, which I have done from not only India, from Australia. My two degrees are from Australia, and one is from the UK, where we had proper 2 years of intensive manual therapy training, and then we had a degree which the exam itself was very tough, with theory separate and practical separate. So you had to pass in both. And if at all during the examination, if there is a negligence even for a slightest of matter, the person was failed. So it is very tough to pass such international exams, and we are governed by laws where we should not do any manipulations which are not in control of the patient, especially the neck. So people who click at the barber's office, please stop doing that, because patients have gone into coma and got into severe slip disc injuries. So do not click your neck as if it's a play. Okay.
Absolutely. And also, I mean, since you talked about, sorry Vivek, I want to complete this thread. So since you spoke about certification, and that obviously was my next question. I know that you have done a lot of international certificates, and you also did your studies abroad, right? But then what made you come back to India? Because many of Indians have got this habit, right? I mean, they pursue education abroad and they want to settle over there. I mean, why in doctor's profession, speaking about us in IT as well, right? So many of IT professionals, they also want to go abroad and then they want to work for people over there, and then they when they want to settle, and then when they want to kind of retire or something like that, and then they come back to India, right? So, and you being, I mean, academically so good, and also studying in the in abroad, right? Why did you come back to India when you had very fair chances of doing well in the overseas?
Yes, as a matter of fact, since childhood I've been traveling to a lot of countries. So all thanks to my father who was in merchant navy. So I did not have the fascination of settling abroad, because even my father chose to stay in India, but he never stopped me from doing that. I went to UK, pursued my career, and I was working at a nice NHS affiliated place, and within a year or two itself, I understood that the job satisfaction that we get in India is much different from what it happens when you are over there, because you're governed by a lot of rules as well. But that was not the major reason. The major reason was that I was more into my own private practice. Even before going to UK, I had a very good set of patients for about a year as I was doing my internship and fill applications. I had a good amount of time where I had gathered, and it was again practice going back to zero, which I faced during COVID time. And again, when the clinic was stopped, practice went back to zero. But I was not afraid because I know that I would again pick it up, and it did pick up very well. So I thought that if nothing happens in India, I would rather go to USA. But when I returned, India had become physiotherapy ready, and we had very good clinics set up, and the standard of living had gone quite skyrocketing high, and people started valuing the physiotherapy that I was giving them. So I think I would thank my patients who literally trusted me, though I was new, and they have been faithful to me. Even my first patient who met me when I came back is still in touch and is still with me. Something happens in his family, the call will always come to me. So it's like a family doctor, I would say. So where I have known people calling me even after an accident, though that is not my department, but they would like to get an honest suggestion whether where should they go to a hospital or should they manage at home. So I feel very grateful that I have such patients who trust me immensely. That's what I should say.
Okay, thanks, Katie, for giving us that honest answer about what made you stay back, or maybe what made you ensure that you would like to explore your career or maybe your professional growth based out in India itself, rather than moving out or finding out opportunities elsewhere in some other uh, you know uh, regions or maybe any other countries, because the opportunities you had maybe that were immense, but taking up or ensuring that you will figure out your own way here in India, back when there was very little awareness about physiotherapy, or maybe saying that people were only used to associate doctor with a person uh, who is there in terms of ensuring that okay, चलो सर्दी खांसी बुखार कुछ हो गया, then I have a doctor, or if I need a surgery, there is a doctor. But what if I have some body aches, or what if there is a prolonged uh, muscle tear that is happening and I need to get it fixed? I don't know whether there is a specialized doctor there, and I think you made or that's where you ensure that you will continue exploring opportunities here in India.
Yes. So whenever when somebody has a muscle tear, so that's a $1 billion question whether we should go for conservative means or operative means, or should we show it to an orthopedic doctor or a physiotherapist or a Haad Vaidya or a chiropractor. So these are all the questions going on in the patient's mind. So whoever you go for, like the general protocol is when somebody has an injury, if it's a bone injury, they strap it and a plaster or a crepe bandage and they keep it till the fracture gets healed. But if it's a muscle tear, uh, a person has to go on a bed rest. But it's again a myth that you should never exercise if you are in pain. Okay. Physiotherapy is not only for chronic conditions, it's also for acute conditions like this. So we are very careful because we are trained in that. If a muscle tear doesn't respond to physiotherapy for more than a month, this is a general protocol for all the doctors, then only we think of going little invasive. That invasion can be an injection, a corticosteroid, when it's a spinal or radicular pain or a knee pain, or later on, right now we have ozone therapy as well, which they pump it into the knee joint. So ozone is O3, which helps in healing. There are other machines like laser, which are also used in healing. Later on, If again the patient doesn't get better, then we go for arthroscopy. Arthroscopy is a small hole which is made, and the part is repaired in that. And if that is also not possible, then we go for open surgery. So, and replacement surgery. So then in replacement surgery, we have to replace the joint. Okay. So these are the stages how a patient should move. A tear patient can decide. There is a lot of time given. You should in fact observe the patient over a year, because there has been a research which says that patients who were operated immediately and patients who were on physiotherapy for a year, the outcomes were the same at the end of 1 year. So that's why you should be very careful and take an informed decision, because most of the time you might harm more by operating early without strengthening the part. So now I have orthopedic doctors who refer pre-surgical physiotherapy as well, where a surgeon knows that a patient has to be operated. So I would give an example of an ACL tear football player. He got an ACL tear on the ground, and he couldn't walk, like he couldn't even stand. The knee was giving away and he was falling. So we knew the surgery had to be done, but that patient was on 2 weeks physiotherapy before the surgeon actually cut open with his knife, because the quadriceps had become too weak immediately because of the trauma. The trauma also causes muscle weakness. So if the patient cannot sustain even to walk, the quad has to support. Quadriceps muscles have to support a knee joint. So quadriceps strengthening, uh, you know, is a must. So I was very proud of that orthopedic doctor who actually, went into the right means of doing pre-surgical physiotherapy. And I think the trend is really changing now in India.
Amazing. Amazing to know that the case that you mentioned. I mean, you already touched base upon one of the myths. So I would like to maybe expand more on this because, as you mentioned, right? I mean, physiotherapy is still, I mean, need to get that much visibility or maybe attention that it needs, right? So maybe for our audiences, if you can just talk about few myths and if you can bust those myths about physiotherapy. Because one of the famous myths is that this is only for athletes or maybe it's a lifestyle kind of a thing. Right? So any myth that you want to bust about physiotherapy?
Yeah, the biggest myth that I've heard is that my back pain is because of gases in my body. And, let me tell you, in dissection, we have never seen gas coming out anytime. So that is the biggest myth. Mostly back pain or a neck pain is because of bad posture. So maybe, and yes, everybody should eat right. So you should modify um, your maida, your bread, whatever you're eating. So diet modification is recommended, but posture itself, if you correct, and if it is not done without a proper exercise and strengthening your muscles, then back pain keeps on recurring, and somehow people start attributing it to gas. Like every time a gas forms, my back pain comes in. So that is absolutely not true. If your back pain is coming back, it's because of your weak muscles. The second myth I busted previously is that when you have pain, you should not do physiotherapy. It's very wrong. Physiotherapy is also for acute conditions. We definitely know how to treat acute conditions. We have machines like ultrasound and TENS which reduce the patient's pain. Then later on, we start exercise with the patient. So you need not worry if you are in pain. You can always call a physiotherapist.
Yes. And I think I have a, maybe this might be a stupid question, but I think I should be asking this, because this is again most of the thoughts or assumptions that we go around is like, maybe if अगर मैं बीमार हूँ then I'll go and meet a doctor irrespective of मुझे सर्दी खांसी बुखार है या I have some dental issues I'll go and meet a doctor or anything, right? But is does that really apply to physiotherapy? Where what I'm trying to understand is like, should I meet a physiotherapist only when I have some issue with my body overall in terms of physical structure or anything, or physiotherapy can also help you, it's like helping to be more preemptive, ensuring that uh, uh, a breakup is or maybe a breakdown can be avoided. So my question is like, it's rather than being more proactive, it's like more ensuring that it's preventive as well.
Yes, this is a very important question. Actually, physiotherapy is about prevention, a lot more for prevention and less for acute. Because whenever you are in pain, actually that's the time when we can do little with you. So we take care of pain in the first few days, and then what we do for more than a week is all prevention. Like we strengthen your muscles, we make your parts strong, we make your posture right, we give you some kind of support, a right kind of footwear. All these are actually treatments. They are a part of physiotherapy. Another type of preventive physiotherapy is required for players, like somebody who is bowling and the speed of bowling is not getting right. Then the physiotherapist is brought in to assess what is wrong, and sometimes a simple stretching of a hamstring muscle can actually increase the speed of bowling in a bowler. So that is something that would amaze you.
Wow, that's so nice to know about this. I think this is the question that Vivek asked. Many people would get their answers over here. So maybe since we spoke about so many cases, right? So we would want to maybe learn or maybe understand your success story of patient. Obviously, I'm one of your success stories. Apart from me, if you want to cover any success story of a patient that got significantly impacted because of your treatment.
Yes, I think the biggest impact that we make are to patients who are not socioeconomically that sound and who would not rather get the facility that a normal well-to-do person might. So I had a call from a female who told me that, doctor, I have arthritis and I cannot come to your clinic. Can you come home? So I usually avoid going home or visiting. So I told that every arthritis patient visits me at my clinic. So you better turn up and show yourself. And then in the evening, I think Ramya, you have seen her many times. Like this female came to me. And she met me for the first time with a huge smile on her face. Like, I was so much waiting to see you, doctor. And what I observed, she was sitting on a chair. She couldn't get up. She actually came in to my clinic in a wheelchair. Immediately, I felt very guilty, and I asked her what kind of arthritis she got, and it was rheumatoid arthritis with 90 degrees of contracture. Contracture means the legs have to be straight. They were bent to 90 degrees, and that's why she could sit, but she couldn't stand. Um, so
I remember
and
this case. Yeah.
yeah, and it felt impossible. Let me tell you, but she had come up with so much of faith, and she said that, doctor, आप मुझे ठीक करोगे. So you can't break somebody's trust like that. So I applied all my knowledge about manual therapy, started opening her knees, and by God's grace, her knees started responding with severe rheumatoid arthritis, where rheumatoid arthritis is a condition where the joint is getting destroyed from inside. But she improved with muscle lengthening, stretching, and we increased the joint play in the by hand, by bare hand, and also giving her muscle stimulation to release the tightness. And slowly, slowly, her legs were like quite normal. Uh, And then we applied a sling so that we could hold them straight. The joints were too weak, the bones had become too weak. And this girl started walking. And the moment she started walking, she got her independence. She was so happy. She used to come
Wow.
on a scooter. After that, I can't believe it. The girl who used to arrive in a wheelchair, she actually came in a scooter. She used to complete her session, and then she could work in kitchen, and now she's married and she has beautiful children. So I'm really proud of this case, and they are still in touch.
Wow, amazing, amazing story. And I do remember the patient that you're talking about. And would you also want to uh, talk about your treatments for athletes? I mean, I know that you're training the champions, right? So would you want to talk about that?
Yeah, I would like to show something that I'm proud of
Yes,
over
yes,
here. So this is my patient Poorva Sawant. So this story was
yes.
printed in Physio Times. So Physio Times is number one magazine of physiotherapy, and I became famous because of Poorva. She was in Khelo India and she won a gold medal. And for every this athlete used to come to me from Godrej school. So all the athletes used to come down, all the children, right from the age of 10, and I used to train them, get rid of their small pains, teach them the biomechanics of the body. So that hit her somewhere because she had the culture of applying physiotherapy to her sleep. Now that is more important the new generation should take from us. And they are privileged enough to get this facility now, whereas previous players never used to get a physio for them. So what happens is your parts work better, the wear and tear is less. And right now, Poorva is has won gold medal in national games. She has done her personal best, and very soon she'll be going for international. So she would be selected very soon, and going and representing India. And I think that would be a proud moment for me.
Absolutely, it's a very proud moment for everyone. Obviously, for you as a as a physiotherapist, helping someone achieve their dream, and maybe if you were anyway contributing to that success, and I think obviously that will make you definitely proud. So thank you for sharing such so wonderful success stories, Dr. Ketaki. And now I think we can move into another direction of this conversation is to talk about the future aspects of the profession that you are into, right? Obviously, here in India, it's maybe we are still into the early stage of physiotherapy as a profession. But what are the new changes or what are the new technologies that you are seeing around which is being getting incorporated into the physiotherapy, especially in the technical aspect of it? Would you like to talk about it? How you see the future of this profession?
Yes, right now I have incorporated a very latest technology of electromagnetic PEMF therapy in my clinic, where we can heal a lot of structures which cannot heal. For example, diabetic soul, then arthritis. There are a lot of new technologies coming in for healing of a small muscle tear. So with the means of electromagnetic fields and as well as some PRPs. So we don't do PRPs, but we can definitely include all those things which can help in going further down, deeper into the tissues and start the healing process right there where it's required. And very soon, I think even physiotherapists might get replaced as robots. So the AI industry is coming in,
Oh
and
God.
you never know. So we always have to be updated. As the robotic surgery has come in, even a robotic physio will come.
But then, I mean, I would like to put across a different take over here. I mean, no one can replace the human touch and the human kind of a treatment that doctors give, right? I mean, because I've been there and you have done that on me, so I can say that I mean that the feel or the relief that we get from the pain with the human touch, I don't think the robots would be doing that. But then everyone has got their place, right? Because we were worried about, I mean, what will happen when smartphones were coming in, right? We were worried about what will happen, how will we keep up with this. But then even with AI, I don't think so. It will harm your job for sure because human touch will always remain untouched, right? So, what are your thoughts on that?
I hope so, but we used to think that a driverless car would be something dangerous, but now it is possible by Tesla. So you never know whether a human would evolve and stop needing the human touch. You never know.
Okay. Uh, so again, obviously we touch base on the future aspect, and I think we still have a lot of traversing to do to reach that stage where we feel that maybe we don't need humans to treat our body, because I still believe it's a long journey for everyone to go through that aspect. But I think the next uh, uh, point, or maybe next thing that would like to get into the conversation is what what are your suggestions or inputs for anyone who would aspire to become a physiotherapist, maybe ever dreaming of? What do you suggest? What should be they doing at this point of time? Obviously, the educational aspect needs to be taken care of. But what apart from that, with your own personal experience that you would like to share?
Yeah, definitely. The student has to give all the exams, like finish the 12 standard, give NEET, to whichever exams they have in their state, in their country. But apart from that, you should ask yourself whether you are competent enough to be a physio. Like, is that in you, or you should be, choosing something else as your career? Because it takes a lot of effort and a lot of commitment, as it does to any profession. But in physiotherapy, it's a physical work more. Like you should have a lot of energy, plus you have to be psychologically motivated. I have seen a lot of physiotherapists when they see babies and which with neurological disorders like cerebral palsy, the physiotherapist goes into a depression where you cannot do much because the parents keep on asking you every day when my child will grow up, when my child will walk, when my child will do all those things, and you have no answer to that. So you should be very, very strong because sometimes it's you that's going to face the patient every day. The doctors will say it once, but you will have to affirm and give a hope to the patient's family and the patient himself every day, so that the patient keeps on performing better and better and better with every session. So that is your key to success. Like if you want patients to take more sessions from you, then you have to keep them motivated and also um, show them a proper path. You have to show your patients a logical path. Don't give them unrealistic expectations, but you have to keep them grounded. So it is a thin line. You're walking on ice. So you should have all those qualities in you which are common to all the doctors. So if you love exercise, you can also be a personal trainer or a yoga trainer. So physiotherapist is a very different journey and a tough journey. So a person should be ready for that. You don't require much money to choose, as I would say. Uh, Even if you're financially sound, you can still do good in physiotherapy if you can wake up every day and handle your patient with dedication. Uh, Nobody can stop you.
So now maybe would like to understand. one other important aspect is, and I think maybe in certain aspects you have already answered it, but I think maybe to be very precise about it, what essential educational qualifications do you think, along with the skills and qualities, are crucial for success in physiotherapy, right? Would you like to talk about that as
Yeah, educational qualification is like 12th, and you have to give an entrance, medical entrance exam. And after that, if you are eligible, you enter physiotherapy. Uh, Apart from that, you can always start reading out anatomy. Right now, you have a lot of YouTube videos, you have applications on the phone. You can just get into human anatomy and start reading that. After that, you can go to human biomechanics and start reading it as a passion. So if that interests you, then maybe you think physiotherapy is the right career for you. And even if you are a physiotherapist yourself right now, these things are very essential. Like how people in stock markets keep on reading about economic times, they keep on updating themselves. So for a physiotherapist, it's very important that you're well versed with your anatomy and biomechanics.
Thank you so much, Ketri, for putting out those things explicitly, because I know there are people in India especially जिनको ऐसा लगता है ना कि मतलब मुझे ये परस्यू करना है, बट उनके पास गाइडेंस नहीं होता है, एंड they are like very passionate about something. And as you in the beginning of this podcast you mentioned, right, to turn your passion into your profession, right? So उन लोगों के लिए ये बहुत काम आएगा. And maybe the last question for today is building a career outside the traditional clinic setting is also possible, right? I mean, because लोगों को ऐसे perception होता है कि डॉक्टर मतलब अपना क्लिनिक सेटअप करना है, एंड देन मतलब डिग्री ले लो, फिर थोड़ा इंटर्नशिप कर लो, एंड देन वी डू अ सेटअप, क्लिनिक सेटअप, राइट? So apart from doing that traditional setup, what all are the other opportunities that today's generation can take up, especially in physiotherapy?
Yeah, apart from working in clinics and hospitals, right now physiotherapists can be part of clubs. They can go to institutions, cricket institutions, and other, there are a lot of IPL events coming up, cricket tournaments, marathons. So you can be a part of an event company which handles all that. That is one aspect. Plus, you can do home therapy. So you can ask people, you can freelance. Basically, patients can contact you directly, and you can go home and do the services. But all this is much better if you are attached to some hospital or attached to a clinic as basic, because then you would not have any control over the kind of patients you would get. So always, if there is an institution backing, that's my advice to every physiotherapist. Instead of going into treatments at your own risk, it's always better that you have a bigger institution backing you up. So yes, freelancing is very good. You have that option, but always be in touch with a senior physiotherapist because we are a team, and we are always there to guide you.
Wow, amazing. I mean, yes, I think people do freelancing in this, but as you rightly mentioned, right? Why would anyone go to a freelancer unless and until they have proven their needs, right? So it's like unless and until people feel, and especially in the field of doctors, right? People require that experience and that trust with the doctor. So unless and until patients have built that trust in the doctor, and especially have the experience of maybe treating patients of different kind of sections, or maybe different kind of ailments, right? Only then will people go to a doctor, because first thing that people check, especially in this profession of doctor, is the qualification and the experience, right? As you rightly mentioned, though people have an opportunity to do freelancing, but they have to, I mean, it's good to get associated and backing from an institute. So, thank you so much, Dr. Ketaki, for coming over and doing this podcast with us. It was a great conversation and insightful one. And I hope people would definitely benefit from your journey and your learning from you today. So thank you so much for coming over to me.
Yes, thank you, Ramya. It was my complete pleasure. And people will not only benefit from this, but whoever approaches me, whether it's a physiotherapist or a patient, I'm always there to guide. So even in our clinic, we don't keep anything disclosed. We teach them everything right from the scratch. So I'm open to anybody who needs to be guided.
Definitely, and we are also will put a link of your maybe handles that you have on Facebook and other platforms. If you have any, you can share that with us. And if needed, we can put the address of your clinic as well, your Ghatkopar and Chembur clinic, wherever, whatever you want us to put on.
Yes, yes, sure, anytime. Okay, then.
Thank you so much for your time today.
Thank you so much for watching the episode patiently till the end. We hope you enjoyed the episode. We'll meet you again in the next episode. Till then, if you like our podcast show, then please do like, share, subscribe, and let us know your feedback in the comment section.